Hello everyone and welcome to this introductory video on the IAHP Yarns evaluation. I'm Rob Monaghan and I'm a Bundjalung Gumbaynggirr man from the north coast of New South Wales. I'm the Managing Director of Monaghan Dreaming, which is one of the partner organisations on this evaluation, where I'm the National Engagement Lead. I'd like to begin and acknowledge the traditional custodians of the various countries and lands on which we are living and working across Australia, and I pay my respects to elders past, present and emerging. This is a really important evaluation for our mob. It aims to strengthen primary healthcare for Aboriginal and Torres Strait Islander people across Australia, and we all know how important that is.
Hello everyone, my name is Roxanne Bainbridge and I'm from the Gungari Kunya Nations from southwestern Queensland. I work at another one of the partnering organisations on this evaluation at Central Queensland University in Cairns, where I am a professorial Indigenous Research Fellow in Indigenous Health. I'm the Principal Investigator on the evaluation.
And hello everyone, my name is Ned Hardyboys and I live in Aotearoa, New Zealand, and I work for the third partnering organisation on this evaluation, Allen & Clark, which is an evaluation and policy consultancy based in Wellington and Melbourne. I'm the project lead on this evaluation. So when the Commonwealth Department of Health asked us to design an evaluation of its investment in Aboriginal and Torres Strait Islander healthcare, which is through the Indigenous Australians Health Program, or IAHP, or IAHP, we spent some time examining the brief to understand their intentions. These intentions have shaped the purposes of this evaluation. At the centre of the evaluation's purpose is the need to facilitate the voices of Aboriginal and Torres Strait Islander people and communities, including by identifying needs and aspirations for health and wellbeing and for comprehensive primary health care, and evaluating how well the system is responding to these things that are valued. The evaluation has also been designed to reflect a strong focus on learning and improvement, both to support improved delivery of services and to inform improvements to national policies and planning frameworks for Indigenous health. Connected to this, the evaluation also needs to facilitate learning and inform solutions at and between different levels of the health system. For example, by looking at barriers, enablers, and changes required within and between local, state, territory, and national levels of the health system. The Department of Health also requires an evaluation that they can use for accountability purposes, so that it can demonstrate to government the difference that investing in the Indigenous Australians Health Program is making. Ultimately, the Department of Health wants the evaluation to contribute to improvements in Aboriginal and Torres Strait Islander people's health and wellbeing, and to progress towards closing the GAPS targets.
The Department of Health also asked us to take a co-design approach to the evaluation, and we've applied these approaches to defining the key evaluation questions, designing the methodology and planning for implementation. We formed and have worked closely with a co-design group. We call this the Health Sector Co-Design Group, or HSCG, because it includes health sector experts as well as some evaluation specialists from the National Indigenous Australians Agency. Here you might recognise the co-chairs, Dr. Mark Wanatong from Apunapima Cape York Health Service and Kate Toman from the Department of Health. We met with all of the partners in the various state and territory health partnership forums to further understand what was important for the evaluation to consider and to learn from what's worked well and what hasn't worked so well from the past evaluation processes. Rob will summarise some of these lessons shortly, but one thing that stood out is that co-design needs to translate into Indigenous leadership, and this is something we are committed through at all levels of this evaluation process, working with and strengthening Indigenous leadership, values and voices. One element of the co-design process was to develop the key evaluation questions. As you can see, the first two questions are framed at the level of the primary healthcare system. The evaluation is interested in how well the Indigenous Australians Health Program enables the system to work for Aboriginal and Torres Strait Islander people. It is not interested in evaluating the effectiveness or otherwise of services. The third evaluation question looks at the impact of the IAHP on people's health and wellbeing, and the fourth question looks at what needs to be done to improve things and make them better. The final question, if you like, is an evaluation of the evaluation itself. So we are holding ourselves to account and hoping to learn from the evaluation methods and processes. The evaluation co-design approach is ongoing. Our next step is to work with you as potential site partners to make sure the evaluation design meets your needs and priorities.
As Roxy said, during the evaluation design, we met with members of the state, territory, health partnerships forums and held a small number of workshops with Aboriginal health services and communities. At these meetings, people told us that we need to make better use of existing data. That data is already collected and reported into the system, but potentially underutilised. That data is important, but that it only tells half the story, and narratives about people's experiences are the least as value. We look beyond service delivery by shining the torch inwards or backwards at national policy and IAHP management processes and make it a true whole of system evaluation. To work collaboratively with people in defining and analysing problems rather than leaping to potential solutions. Too often solutions are proposed without a common understanding of the problem. Given the 3-year implementation timeframe, the evaluation needs to be able to respond to emerging priorities and needs. And I guess the current pandemic situation is testament to that. To take a strengths-based approach and share the profile of success and build on existing capabilities.
Before we wrap this up, we'd just like to remind you about the Indigenous Australians Health Program, which is the focus of this evaluation. The IAHP was established in 2014 when 4 existing funding streams for Indigenous health initiatives came together. The IAHP, as you can see, is made up of numerous programs and activities, which here are grouped under 5 themes: primary healthcare services, targeted activities, services to improve access, capital works, and governance and systems effectiveness activities. The evaluation focuses on the primary healthcare services part of the IAHP, which is the majority of funding and includes funding to support the delivery of comprehensive primary healthcare, 85% of which goes to community-controlled health services. However, given the systems approach to the evaluation, as captured in the evaluation questions, the evaluation will consider the influence and interactions between this funding and other parts of the IAHP and between this funding and the wider primary healthcare system. So while the evaluation focuses on the funding for comprehensive primary healthcare under the IAHP, the scope is broader than this.
To wrap up, I'd just like to draw your attention to 2 more things. The first is you might be wondering why the word yarns. And yarns came about from a focus test workshops that we held with Aboriginal health workers. And as culturally, Aboriginal people sit around and have yarns. And they drew these acronyms from the word yarns, yarning, taking action, reflecting as part of a national evaluation with a systems focus. It is also considerably shorter than the full title, which is Evaluations of the Australian Government's Investment in Aboriginal and Torres Strait Islander Primary Healthcare through the Indigenous Australian Health Program. Finally, please watch the next video in this series on the yarns evaluation approach and check out the project website, iahpyarns.com. For further information on the evaluation and the evaluation team, the evaluation design and the view of the first annual report, we hope to see you at the upcoming webinars for site partners which cover the evaluation approach, data sources and our approach to data sovereignty and what's involved in partnering in this evaluation. Thank you.